For the squat stance, I will demonstrate the proper technique of a body weight air squat. The main muscle groups that the squat trains are the muscles of the thighs, hips, core, buttocks, and quadriceps. The movement begins from a standing position with the feet about shoulder width apart. A person needs to squeeze their glutes and lower their rib cage to maintain neutral spine through the entire movement. The movement is initiated by moving the hips back and bending the hips and knees to the lower torso. As the body goes down, the hips and knees undergo flexion, the ankle dorsiflexes, and muscles around the joint contract eccentrically. Some common errors when doing this movement include the knees going over the toes, the person descends too rapidly causing the torso to come forward, and when a person breaks neutral spine by keeping their head up. A person can fix these errors by putting two weight plates so that the feet are in slight plantar flexion. For the split stance, I will demonstrate a movement called a split squat. A split squat focuses on the core, gluteal muscles, quads, and hamstring muscles. The movement begins from a split stance. In order to be in neutral spine, squeeze the glutes and lower the rib cage by engaging the abdominal muscles. The person will then lower themselves, emphasizing the weight to be on the front leg. Common errors during this movement would be a person breaking neutral spine, the knees go over the toes, and the person starts to bow forward. To fix these errors, explain to the client to keep the knee aligned with the toes, keeping the chest up and core tight. For a horizontal pulling exercise, I will demonstrate a bent over row. The bent over row trains a variety of the back muscles like the latissimus dorsi, rhomboids, transverse extensors, and core. It can be performed with a barbell, dumbbells, or with no weight. The movement starts with the feet about shoulder width apart and the knees slightly bent in an athletic position. The person then bends the torso, maintaining neutral spine by contracting the abdominals and squeezing the glutes. The person will then pull their arms up while the palms are in supination, squeezing the scapula muscles in the back. Some common errors in this exercise include breaking neutral spine, not initiating the movement with the upper back muscles, and pulling the elbows too far from the torso. To fix these errors, the person needs to pull the elbows closely to the body, working the lat muscles of the back, or they can use no weight and worry about technique. For a horizontal push exercise, I will demonstrate how to do a bench press while lying on the floor. So in this case, it is called a floor press. The floor bench press trains the pectoralis major, triceps, and shoulders. The conventional bench press horizontally adducts the shoulder. This movement can either be done with dumbbells or a barbell. The movement starts with the person lying in the supine position. The reason that the person is not on a bench is because we are trying to avoid the shoulders from breaking 45 degrees. The person will maintain neutral spine by contracting the abdominals and squeezing the glute, keeping the neck relaxed on the floor. If the person is using weight, they will slowly lower the weight with a smooth tempo until the triceps and elbows touch the floor. Then they will squeeze the chest and push the weight back up. Some common errors that occur in this movement is when a person lifts their neck off of the bench or the floor, which breaks neutral spine. To correct this, a person should relax their neck on the floor. For a vertical push exercise, I will demonstrate a lateral shoulder raise. The movement begins with the person standing up with their feet about shoulder width apart. The person will maintain neutral spine by contracting their abdominals and lowering the rib cage. The arms start out at the side of the body and slowly lift until the arms reach shoulder level. Once the arms reach shoulder level, the arms come down with a slow and steady eccentric tempo. One error that occurs in this movement is when a person tries to do too much weight, causing them to use their legs or any other body part. The lateral raise isolates the shoulder, so it should be done with light weight or no weight. When a person starts to use their legs and other body parts, this can usually cause neutral spine to be broken. To correct this, a person should do light weight and should make sure their concentric and eccentric tempo is nice and controlled.